Let's begin. Alright, so welcome back. I'm your personal acupuncture physician, Fitz. So today, we're going to talk about bad breath. Bad breath. Some of y'all do suffer from bad breath. But don't worry, it's okay. Acupuncture can help. But before you go to your acupuncturist for any bad breath issues, always make sure you go to the dentist first just to rule out any major gum disease or tooth decay or anything like that. So after that's done and your breath still stinks, then you can see an acupuncturist, alright? When it comes to acupuncture diagnosis for bad breath, it's basically three major types, okay? We call it stomach heat, lung heat, or food stagnation. And the way you would treat it as an acupuncture physician, after you do your exam, of course, let's go over stomach heat. So some of the symptoms for a patient with a stomach heat pattern is going to have bad breath, of course, bleeding gums, because it's heat, when your gums bleed in Chinese medicine, we call that heat, all right? Frontal headaches because headaches in the frontal region corresponds to the stomach, believe it or not, all right? You're going to have a red face, dry lips. Remember, it's heat involved, dry lips, and hunger. Excess of heat can make you hunger and even more thirsty. The tongue is going to be red with a dry yellow coat, all right? The pulse is going to be big and rapid, or be white rapid, because remember, it's heat, speed things up. So the herbal formula that I probably recommend is called Qi Cheng Tang. All right, very great formula to help with stomach heat, hence help with bad breath. Now, when it comes to the point prescription, of course, as an acupuncture physician or acupuncturist, you can use points you deem necessary, but I recommend at least try to use these points. Ren 12 is good for that. Stomach 44, definitely good for heat. It's on the stomach channel. It makes sense. PC7. Li4 corresponds to the face in general, all right? Li11, we all know, releases heat, right? We all know that. And stomach 45 definitely releases heat, all right? So that's my point prescription when it comes to bad breath due to stomach heat, all right? Now, let's look at bad breath due to lung heat. What are the symptoms with that, okay? It's going to be bad breath, all right? Also going to have a red face and red nose. Dry mouth, thirsty. Because remember, heat makes you thirsty. Constipation. Remember, the lung and large intestinal channel are actually related, or connected. A tight, hot chest. Because, it's in the lungs. So the lungs is going to feel hot. Or your chest is going to feel hot. The tongue is going to be red with a yellow coat. Red with a yellow coat, red means heat, yellow coat means, heat also, and rapid and large. So, the herbal formula that's good for this type of pattern is called Shiman San, alright? That's a very good formula for this type of pattern. Now, the points I would use if the patient with bad breath comes in with lung heat, of course, we're going to use lung 5, of course. Lung 5 is very optimal for this condition. We're going to use lung 6 also, lung 11, lung 1, try to find it, Li4, and bladder 13. Again, as an acupuncturist or acupuncture physician, you could use other points, but I recommend using at least those base points to begin your treatment. Right? Now, the last pattern when it comes to halitosis or bad breath is going to be from food stagnation. That makes sense. You got food stuck, right? So, the symptoms are going to be bad breath, heartburn. The food is stuck. It's not digesting properly, stagnated. Acid reflux, right? Acid reflux, indigestion, gas, nausea, bloated. The tongue is going to be thick and with a greasy coat. And the pulse is going to be slippery, which I'm sure y'all know that already. Now, it's no secret, the herbal formula for this should be Bahiwan. I mean, we all learned this in school, and that's a formula that's very good for stagnation. The points you should probably use is Ren 12, stomach 36, stomach 44, Li 10, and PC6. PC6 is good for a lot of stuff, stress, chest, but also good for digestion. Okay? So, again, this is the points I recommend you use, if you're acupuncturist, that is. Alright? But this is for educational purposes only. If you're a non-acupuncturist or non-acupuncture student, this is good information just to know, but don't ever try this. If you're an acupuncturist or acupuncture student, consult with other acupuncturists and see if those points works for you, alright? So, if you got knowledge from this video, please don't forget to subscribe and like, and tell your family and friends about Prestige Acupuncture channel. What are you waiting for? It's called Acupuncture Physician Explains. See you next time. The end.